Has this ever happened to you? Today on The Doctors. Find out how to treat it.
Welcome to the show. Today we will be talking about the treatment of cardiac arrhythmias with beta blockers. What are beta blockers, I hear you ask?
Well, doctor, a beta blocker is essentially a beta adrenoceptor antagonist. This means it binds to heart tissue and blocks it, therefore decreasing sympathetic nervous system outflow.
So how does it do this?
So, if we look at the picture down below here, once we get to the postsynaptic noradrenoreceptor, noradrenaline can no longer bind to the heart muscle because these beta-1 adrenoceptors have been blocked by the drug we have introduced into your system.
So thus, this decreases heart rate, cardiac output, and total peripheral resistance. This also inhibits renin release, thus decreasing angiotensin II, but we will discuss this on another show.
After the break, we'll be talking about the sort of treatments you might use a beta blocker for.
Have you ever felt like this?
You ate one of my donuts!
My beans!
The most perfect sandwich that has ever existed.
I will kill you with all my hopes and regrets. This castle is in unacceptable condition! Unacceptable!
Try Prozac. Wash those blues away.
Welcome back to the program.
Now we'll be discussing what beta blockers are used in the treatment of. So they're used in the treatment of hypertension, although they're not the first choice, angina, post-myocardial infarct, arrhythmias, and they also stabilise heart failure. Their other uses, though, are in glaucoma, thyrotoxicosis, also known as hyperthyroidism, anxiety, and migraines.
Again, that's very interesting, doctor. But what sort of drug should we be looking for if we're looking to see if we're on a beta blocker?
Okay, so you could be looking at using atenolol or metoprolol, which are both beta-1 selective antagonists. But you may also use propranolol, which is a non-selective beta antagonist, which may cause side effects. What side effects?
So, some of the side effects we find with non-selective beta adrenoreceptor antagonists is bronchoconstriction. This usually occurs when the beta-2 adrenoreceptors on the bronchi have been antagonized or blocked, which means that instead of vasodilating under normal sympathetic outflow, they have now been constricted.
Got me, I got bronchitis. Ain't nobody got time for that.
Now, some of the more common beta blocker side effects, which can be seen in beta-1 selective, is cardiac depression, bradycardia, and hyperglycemia, which is very common in diabetics. Less common side effects include fatigue, cold extremities, and bad dreams and depression. So when you're prescribed to a beta blocker, sometimes your GP might prescribe you to a combination of therapies. What might this include?
So this might include an ACE inhibitor, usually used in post-infarct patients. You may also be given a calcium channel blocker or a thiazide diuretic, although not in diabetics.
When you say not in diabetics, are there any other contraindications that we should be aware of before prescribing a beta blocker?
Of course there are, but you may want to discuss these with your GP first. But you should avoid a beta blocker with verapamil. This may cause a heart block. If you have asthma, you also should not use a beta blocker, or if you have chronic obstructive pulmonary disease, or known as COPD, as well as diabetes, as previously mentioned.
Well, that's all we've got time for today, viewers. Thank you for joining us. Today's program has been brought to you by Science.
Yes, science!